This is part 3 of the Chapter 1 lecture notes. We had left off, excuse me, we'd left off on this slide of, it's an illustration of how our body maintains normal body temperature. So it is an example of negative feedback. And I just wanted to point out that the receptors would be the body's temperature sensors. Some of those are in the skin and some of those are in other areas, but they detect, for example, the temperature rising or the temperature lowering. That's the stimulus. And then the receptors send that information to the control center, which is actually in the brain, and it's a structure called the hypothalamus. And the hypothalamus then sends commands if the temperature has risen, if the body temperature has gone up. Then it tells the blood vessels and the sweat glands in the skin to respond by increasing blood flow to the skin, increasing sweating. This is going to cool us down. It's going to lower our body temperature, which is opposite or negating the original stimulus. And then you can read the way that our body responds to a decrease in our set point. But this is an example of negative feedback. In any of the conditions in our body that are maintained within a narrow range, like there's a narrow range or a healthy range where your blood sugar should be, your blood glucose levels. And that is maintained by negative feedback. Blood calcium levels are also important because too high or too low could lead to actually paralysis. Your muscles won't work and your nerves won't work because they depend on this healthy range of blood calcium levels. Blood pH, blood pressure, breathing rate, these are all different things that are maintained by negative feedback. Well, positive feedback is not as common, but this is when the response actually increases the stimulus. Blood clotting is an example. So I'll explain it this way. When you bleed, your blood starts to clot, and then it starts to clot some more. It starts to clot some more, starts to clot some more. It's just an increase until the process is over, until you have formed a clot that has stopped the bleeding. Labor during childbirth is another one. You have labor contractions that are not as strong, and then they increase and increase and increase. They don't slow down. They don't, go up and down. They get stronger, stronger, stronger until the child is actually born. So these are the two really best examples of positive feedback. And this shows you the process of blood clotting. This is a little bit more detail. Now we're going to go on to the section that's known as medical terminology or anatomical terminology. The first thing that you absolutely need to know, because if you don't know this, then you're kind of lost when it comes to structures that we talk about, that you read about in the text. When an individual person is in the anatomical position, they are standing up. Their hands are at their sides, the palms are facing forward, and their feet are together. And then if the person is lying down in the anatomical position, face up is supine, face down is prone. You need to know every term on this page, and I always get the same questions, so I'm going to go ahead and tell you. You have a term in bold, that's the structure. Then you have a term in parentheses, that is the region. You do need to know both of them because they're different parts of speech. So we're going to start at the top on the left side of the page, but remember it's the right side of the person. Okay, hope everybody's with me on that. All right, so because it'll be this way for all figures, will be just because I'm going over words that are on the left side of the page, we're on the right side of that person's body. Okay, so we're going to start at the very top. The forehead is the frontal region. So you need to know the term frontal. The entire head is known as the cephalon or cephalic region. Cephalon or cephalic. The skull part is known as the cranium or cranial region. And then the facial part of the head is known as the face or the facial region. The mouth is known as the oris or the oral region. The chin is the mental region. Some of these don't have a word in bold. That means we just call it the chin. The chin is the chin. Or if I ask you the body region, you would call it the mental region. What's the reason it's important that you know this, these terms, is when we start learning the muscles and the bones and the blood vessels, it's going to be important that you know these terms because some of those structures are named after the region of the body that they're in. I can think of one right now. You know, when you go and you have blood drawn from the bend in your elbow, that's called the median antecubital, well, actually, I'm sorry, it's called the median cubital vein. Sorry, median cubital vein. And so that's where that comes from. The front of the elbow is the antecubitus or antecubital region. So we call that vein there the median cubital vein. Okay, so let's move on. The armpit is the axilla or axillary region. The arm, which is actually the upper arm, this is important too. You need to know that we call the arm, when we say arm, we don't mean the whole thing. In anatomy, arm refers to the upper arm, and that is the brachium or brachial region. The bend in the elbow, the front of the elbow, is the antecubitus or antecubital region. The forearm is the antebrachium or antebrachial region. The wrist is the carpus or carpal region. The palm of the hand is the palm or palmar region. The thumb is the pollex. The fingers are the digits or phalanges, or you could say the digital or phalangeal region. All right, let's keep going down. The kneecap is the patella or patellar region. The leg, now remember the arm. In anatomy, the arm is the upper arm, the brachium. In anatomy, the leg is the lower leg. So the leg is called the leg, and it's the crural region. The ankle is the tarsus or tarsal region. The toes are the digits or phalanges, and that is digital or phalangeal region. And the big toe or great toe is called the hallux. Going up to the top again on the right side of the page, but the left side of the figure, we have the nose, which is the nasus or nasal region, the eye, which is the oculus, and you can call that the orbital or ocular region. The ear is the oris or the otic region. The cheek is the buccal region. The neck is the cervicis or cervical region. The chest is the thoracis or thorax, and it's the thoracic region. The breast is the mamma or mammary region. The abdomen is the abdominal region. The navel is the umbilicus or umbilical region. The pelvis is the pelvic region. The hand is the manus or manual region. The groin is the inguinal region. The pubis is the pubic region. The thigh is the femur or femoral region. And then the foot is the pes or pedal region. Now let's look at the posterior view or the back view of the man. starting on the right side, which is actually the right side of the figure, which is actually his left side. Okay, so shoulder is acromial region. The back, which is like the upper part of the back is the dorsum or dorsal region. The elbow is the olecranon or olecranal region. The loin, which is lower back, is the lumbus or lumbar region. The buttock is the gluteus or gluteal region. Back of the knee is popliteus or popliteal region. The calf is the sural region. The heel is the calcaneus or calcaneal region. The sole of the foot, bottom of the foot, is the planta or plantar region. Again, the head is the cephalon or cephalic region. Neck is cervicis or cervical region. And then we have upper limb and lower limb. Those you have to know, okay? So we've done the anatomical regions, and then we can also map the abdomen and pelvis using abdominopelvic quadrants. There are 4 of those. They are used by clinicians to locate aches, pains, and injuries. And then the abdominopelvic regions. There are 9 of those, and they're used when we need a more precise location. All right, so your quadrants are, remember this is the left side of the page, but it's the right side of the person. You got right upper quadrant, right lower quadrant, left upper quadrant, left lower quadrant. And for the regions, you have, let's start in the middle. You have the umbilical region where the navel is. And that we already learned. Above that is epigastric. That epi means above and gastric means stomach. And it is above where the stomach is located. The stomach's located around here. So it's above the stomach, epigastric. And then below the umbilical region is the hypogastric, which is below the stomach. Hypo means below. And we also call that the pubic region. So epigastric, umbilical, and hypogastric or pubic region. Now let's go over to the right side of the man on the left side of the page. Right hypochondriac region. Chondra means cartilage. There's cartilage in the ribs. And so I just look at it like that below the ribs area. But that's going to depend on whether that makes sense for you or not. But anyway, this is the right hypochondriac region, the right lumbar region, which is parallel to the lumbar region of the back, and the right inguinal region, which is right there at the groin area. Then we have on the left side of the man, we have the left hypochondriac region, left lumbar region, and left inguinal region. Those are the 9 regions. And so that you can see the quadrants and the regions together, let's see, the spleen is located in which quadrant? It would be in the left upper quadrant. This is the left upper quadrant here. So the spleen is located in the left upper quadrant, and it is located in the left hypochondriac region. So these are the types of questions you would have. You don't have to know everything by heart. Let's take another one that's easy to see. The appendix is located in the right lower quadrant, and it's located in the hypogastric or pubic region. I had to think about that one. Okay, directional terms are very important. They don't have all the directional terms listed here, but they do on that page. So they help us to kind of provide orientation. Anterior is the front of the person. Anterior or ventral is like the stomach, so they are often used interchangeably. Posterior is the back of the person, and so is dorsal. Okay, so we have medial towards the middle, lateral towards the side. Like the arm is lateral, the navel is medial. Proximal and distal, I will explain in the next lecture. posterior toward the back, anterior toward the front, cephalic or cranial toward the head, and caudal is toward the feet or the